There's a new kid in town when it comes to testing to see what your future risk of diabetes is, and that's called the Diabetes Risk Index. The Diabetes Risk Index is a measurement of what I talked about in my last video called the lpir, which is a measurement of the different sizes of lipids in the blood, which we talked about can be linked to insulin resistance, along with two what are called amino acids or parts of protein that are measured in the blood. These two amino acids are valine and leucine, and this came out of the PREVENT trial, a trial that was aimed at looking at preventing diabetes and end-stage renal disease. This test ended up being very predictive of the risk of diabetes versus what we normally do now, like the HOMA-IR or looking at someone's body mass index or their triglycerides or HDL. In this study, a person who was at the top quartile, the top 25% of this score, had 12 times the risk of developing diabetes over the course of the trial as a person who was in the lowest quartile of this diabetes risk index score. This study had limitations in that nearly everyone was of European origin, and so therefore it did not look at this particular test in diverse populations. However, this test is going to be really interesting to watch over the coming years as far as predicting risk of diabetes before it happens.